Hi, I'm physical therapist Natasha Taylor, and I'm a member of the American Physical Therapy Association. Today I'm going to go through a series of exercises for lower extremity flexibility and joint mobility, aimed to help with general stiffness, mild pain, or muscular tightness. It's good to know that the benefits of stretching occur after a workout, so you'd want to do these exercises after your strength training workout, an aerobic workout, or cardiovascular exercises such as walking, running, or biking. Stretching has also been related to stress management. You can add this as an adjunct to the exercises you're already doing at home, as well as throughout the day if you're sitting a lot due to working from home. All right, let's get started. I want to start with some high knees, some just gentle knee march, knee lifts. If you can get them past 90 degrees, that's great. If you can't, start down here. If balance is an issue, use a wall, use a table, use a chair, and support yourself, but stay up nice and tall, and just gently bring those knees up as high as you can. You would do this for about 30 seconds to a minute. Then I want you to go into some hip swings. So gently swinging forward and back. Again, don't worry about how high you're kicking forward and back, it's just that you're moving the leg. Also, stand up nice and tall. Try not to do any kind of pendulums or anything like that and hurt yourself. Right here. 30 seconds to a minute, both sides. Good work. Okay, first stretch, we want to go into the hip flexors, the quad muscles, the deep pelvis muscle right here. Starts deep in the pelvis, comes all the way down and starts to below your knee. So I want you to take a step forward with your right leg, step back with your left. I'm nice and tall. I'm going to tuck my pelvis under, and I'm going to gently lunge forward. I'm not putting a lot of force on this leg. I'm also not in a static lunge. I'm just in a stretch. As soon as I feel it in the front of my pelvis, in the front of my hip right here, I'm going to stop and hold this position about 45 seconds to a minute. I'm going right here. I'm not leaning forward. I'm not arching back, trying to get a real deep lunge. I'm just right here. All right, then you switch sides after about 45 seconds to a minute. Same thing. Tuck that pelvis, lunge forward. Feel it in the front of the right thigh, in front of that hip pelvis muscle, pelvic bone, my bad. All right, you're going to hold it right there. Good. So from here, you can take it down to the floor. I've got a towel that I folded up. I'm going to put it on the ground. I'm going to kneel on that. So my left knee is on this towel. I'm stretching my left hip flexor. Right foot is forward. Nice and tall, same thing. Tuck that pelvis, gently lunge forward. Go as far as you can go that you feel a stretch but no pain. Hang out here. Again, 45 seconds to a minute. Protect your back. Try not to arch back. Also nice and tight through the, if you pull in through your stomach muscles, you'll protect your back automatically. So I'm right here. Good, you back off and do both sides. So now I'm going to use this towel and go to the floor. I have a belt also I can use for these stretches. Again, going to the floor is difficult. You can do this on the couch. You can do this on your bed. You want to be safe. I don't want you getting on the floor and you can't get back up. So lie on your back. Take my towel or my belt around my foot. I'm going to lie on my back. I'm going to keep my right leg bent to protect my low back, and I'm going to gently pull my foot towards my face. I feel a stretch in the back of my leg, my hamstring muscle. Same thing. I want to hang out here a good 30 to 45 seconds. You're going to do this about 2 or 3 times on this leg. I want you to back off and then kick that heel straight back up to the ceiling and pull forward. You might get a little bit deeper. If you don't worry about it. Again, you should feel a strong pull, but not pain. Good. So you do that 2 sets, 30 seconds, each hold. Let go. I'm going to take my foot again. I have that belt wrapped around my foot. I'm going to stretch out my right leg, again, only if it doesn't bother your back. I'm going to gently bring that leg up and over towards my right shoulder. It's not going to touch my shoulder. I'm not rotating and twisting. I'm not bringing my hip or back off the floor. I'm just pulling enough to get a nice stretch through my IT band, and I'm hanging out here. Again, you can do this with a towel. So you take that towel, wrap it at the top of the foot. You've got it. My left hand is down, the towel's in my right hand, and I'm pulling across. Just like that, keeping my back down. All right, so that was IT band. Next one is the Piriformis. So I want you to take your left foot, put on your right knee, wherever's comfortable. If you can, you're going to pull that knee towards you, towards the opposite shoulder. I'm feeling a strong stretch through the side of my hip again and my buttocks, the lateral aspect of my butt posterior right here. So I'm holding, I'm not getting any pain. If for some reason you're having hip pain, hip like a pinch, feels sharp, you want to stop that stretch. Or you want to push away and see if you can get the same effect in the muscle without aggravating any groin pain. Okay, as long as that doesn't bother you, you're going to stand there. So the last one I'm going to do is actually for the lower back. So the way our low back is designed, the way our body is designed, the lower part of our spine, our lumbar spine, works opposite of our hips. So for activities such as walking, getting up from a chair, going up and down, going up the stairs, you want to make sure you have some nice, good lumbar extension, it's called, which is the opposite motion of the hip going forward. So for this last stretch, you'd be on your stomach. Again, if you're already on the couch or the floor or the bed, you can do this. Want your hands about chest level or a little bit in front. I'm looking down and I'm just gently pressing myself backwards. Does not hurt. I'm going to get here and I'm going to just pause for a little bit and then I'm going to come back down. It's not a push-up, it's not triceps, just light through the lower back. And I'm stretching my back. You can do that 10 times at the end of this exercise routine. Okay, so that's all I got for you today. So we did some lower leg stretches, mainly for the muscles that attach to our hips. We ended with a little lumbar extension stretch just to help get into that extension position, which balances off the front of the hips again. And I hope you feel better. All right, thanks for choosing physical therapy, and we'll talk to you soon.